Hi, my name is Riddhi Ambukar and I am an intern from Wedding Dental College. Today we are going to discuss some frequently asked spotters which is asked in the exam.
Let's look into the first spotter, that is headgears. We'll see what are the uses of headgears. It is used as an extraoral orthopedic appliance in growing patients for correcting skeletal class 2 due to prognatic maxilla. To distalize the maxillary dentition or maxilla, encourage augmentation, distalization of molars and space maintenance. Now, what are its principles? There are 5 principles in total. The first one is center of resistance of maxilla, that is the posterior superior aspect of zygomatico-maxillary suture. The second one is center of resistance of dentition, that is between the roots of premolars. The third one is center of resistance of first permanent molar, that is mid-root region apical to the furcation. The fourth one is the line of action of force, and the fifth one being the point of application of force. Now, what are the different types of headgears? They are cervical headgears, occipital headgears, combination headgears, vertical pull headgears and asymmetrical headgears. And now we'll see what are the sites of anchorages present for headgears. That is, the first one is occipital, parietal, nape of the neck and combination. What are the 3 main components of the headgears? They are face bow, force element, head cap or cervical strap. Now, the second spotter is face mask. What are its uses? They are used for anterior protractory force, prognatic syndromes, maxillary intrusions, clefts and mandibular prognatism. Where are they indicated? They are indicated in the skeletal class 3 due to retrognatic maxilla and prognatic mandible. For bending condylar neck for stimulating TMJ to posterior displacement of chin. For correction of post-surgical relapse after osteotomies. And lastly, for selective rearrangement of palatal shelves in cleft patients. What are the sites of anchorage for face mask? They are chin and forehead. What are its parts? They are chin cup, forehead cap, intraoral appliance and metal frame. What are the different types of face mask available? They are protraction headgear by Hickman, face mask of Delaire, Tubinger model and petite type of face mask. What are its biomechanical considerations? First, the amount of force that is required is 450 gram per side. Second, the direction of force, that is 15 to 20 degree towards a downward pull, and the duration of force, that is 8 to 12 hours. This is a face mask and its key. Now we will look at the parts of a face mask. Here it is a chin cup which rests on the chin. This is a crossbar and this is a vertical rod which altogether is called as a metal frame. Now this is a forehead cap which rests on the forehead, and this is a cervical strap. This is an adjustment knob with a key. It is used to adjust depending upon the varying length of the patient's face. As we can see, we can move it up and down depending upon the desirable length that we need. Our third spotter is chin cup. Now, what are its uses? It's an extraoral orthopedic device for skeletal class 3 due to prognatic mandible only. They retard or restrict the forward and downward growth of mandible. What are its types? They are occipital pull chin cup, vertical pull chin cup and combination pull chin cup. What is the line of direction of force? There are 2 directions. First is acting directly through the condyle and second is acting below the condyle. What are its biomechanical considerations? The amount of force used is 300 to 600 gram per side and the duration of force is up to 12 to 14 hours per day. Now, what are the effects of chin cup? They cause a redirection of mandibular growth, lingual tipping of lower incisors and improvement in skeletal and soft tissue profile. Now, our last spotter is extraoral elastics. Now, where are they used? They are used to produce heavier force for orthopedic appliances for a longer period of time. How to engage these extraoral elastics? They extend from hook on canine region with attachment on the vertical rod of reverse pull headgear. The instrument used for the measurement of the force, it is Dontrig's gauge. And how much force does an elastic provide? It provides up to 350 to 400 gram per set.
This instrument here, it is called as Dontrig's gauge. It is used to measure force of elastics, arch wires, coil, springs. The two ends have calibrated shaft. This hook end, as we can see the markings, the force is measured in ounces and grams. These lines here present, that is 1 ounce is equal to 28.3 grams. These are extraoral elastics which are used for orthopedic extraoral appliances. This is a Dontrig's gauge. Now I will demonstrate how these extraoral elastics engage using the Dontrig's gauge. As we see, first we engage it to the buccal tube of the first molar, that is on the hook of the buccal tube, and then we use the Dontrig's gauge to extend it to the force module, and then we check the amount of force that has been used. These are the following book references that have been used for the spotters that we discussed. I hope you liked the video. Thank you.